Welcome to Bearded Psychology. This two-part video series will focus exclusively on anxiety, using statistical data and empirical research findings to explore prevalence rates, symptomology, and effective evidence-based treatments. I decided to begin this video series by examining the stark and somewhat alarming prevalence rates of anxiety worldwide. Estimates suggest that up to 30% of people will experience an anxiety disorder at some stage in their life. That equates to over 2 billion people. In 2015, anxiety disorders were the 9th leading cause of global disability and more common than both asthma and osteoarthritis. In children, aged between 10 and 14 years, anxiety disorders were in the top 4 leading causes of disability. In adolescents and adults, aged between 15 and 39 years, anxiety disorders were in the top 9 causes of global disability. Between 1980 and 2009, global anxiety prevalence rates were 7.3%, with higher rates reported in Western populations. By 2016, estimates show that figure had risen to 12% of the global population. Currently, data shows that anxiety disorders are the most commonly reported mental health problem, with nearly 1 in 5 people in the United Kingdom presenting with symptoms of either anxiety or depression in 2014. I imagine it wouldn't be uncommon to gasp and feel somewhat dismayed by those figures. Anxiety disorders pose a serious mental health concern, and prevalence rates are increasing worldwide, affecting children and young adults more often than older adult populations. This has led many mental health experts to generate a plethora of research, investigating both the onset and development and effective treatments. But before we explore these treatments, it's important to understand exactly what anxiety is. There are a variety of anxiety disorders, differing in terms of etiology and duration of symptoms. Some of these include generalized anxiety disorder, social anxiety disorder, obsessive-compulsive disorder, and certain phobias. The DSM-5 defines anxiety as a state of inner emotional unease in response to a perceived threat, resulting in periods of prolonged rumination, over-arousal of the autonomic nervous system, and avoidance behaviour. OAT 2011 suggests that anxiety is an inability to regulate typical fear response in absence of threat. Diagnosis for an anxiety disorder is warranted if symptoms persist for over 6 months and occupy most of the individual's waking day. The causes of anxiety disorders are a combination of genetic and environmental factors. It's important to note that appropriate levels of anxiety are normal and necessary in some incidences. Experiencing anxiety before an important exam or job interview is considered healthy and can be beneficial by increasing blood flow to your brain, sharpening your cognition, and boosting your alertness. However, if you experience constant, intense anxiety in absence of threat, this may be an indication of an anxiety disorder. Physiological manifestations of anxiety include irrational fear, elevated heart rate, excessive sweating, dry mouth, difficulty swallowing, muscle twitches, and reduced sex drive. Psychological manifestations include nervousness, a sense of dread, constant worrying, overthinking situations and events, worrying that a panic attack might happen, fear of losing your mind, and feeling alone and disconnected. In part 2 of this video series, I will explore the effectiveness of cognitive behavioral therapy in treating anxiety symptoms, which according to most experts is the gold standard treatment for anxiety. To learn more about anxiety and to find links to the original research cited throughout this video, visit beardedpsychology.com. Thank you for watching and make sure to subscribe.